Hey there to all. My name is Kelly, and I, like many others, are going to be a brand new family nurse practitioner very soon. I've completed many hours, days, weeks, months, years of training for this new position. I've listened to lectures, reviewed PowerPoints, read numerous books and journal articles. I've got years of experience as a practicing nurse, years in clinical, preparing me for the day that I'm on my own. Even with all this education and experience, one day I'll have a patient enter my room and will be stopped straight in my tracks, not knowing what to do to provide treatment. This happens to all of us, but today I'm going to prepare you for the newly diagnosed schizophrenic patient. You see, this patient's going to walk into your room with any chief complaint. They could be male or female, probably be under the age of 25, but can be from any social class. Most likely they'll have poor care and social rejection. And when you ask about their family, they're probably going to explain that a parent as well suffered from some type of similar issue, whether it be substance abuse, mental illness, the inability to provide or keep up a job. It'll be highly likely that they have a poor mother-child relationship or even be adopted or out of foster care. You, like always, will perform a detailed history and physical. And it'll be likely that you will find hallucinations, delusions, disorganized speech, like loose association, disorganized behavior, and negative symptoms such as apathy. Okay, so what does that really mean in English? I'm here to give you some good examples, not using fancy words. Okay, we're going to get to the nitty gritty. Hallucinations. Okay, so you're not always going to have these people saying that they see ghosts necessarily or hearing voices like they do in the movies. Most often, these patients are going to hear their own voice, and they can even hear clicks or non-word sounds. Delusions, it's going to feel like your patient believes they are being tormented, followed, sabotaged, tricked, or spied on. Many of these patients obsess that they're being watched by the government. They'll have disorganized speech, and this means that they're going to respond to your question with some kind of unrelated answer. We've all been there, but this is going to be constant, or they're going to shift topics very frequently. This disorganized behavior that I talked about is where they're going to have, this is where their poor hygiene comes into play. These patients cannot complete just routine daily tasks like dressing, bathing, and brushing their teeth. They show emotions that are not appropriate to the situation, like smiling when there's a sad topic or a flat affect whenever there's a happy time. This last symptom that I listed above is called apathy. This means the patient has impaired motivations and reduced goal-directed behavior. So most oftentimes, these patients are going to be seen by their family and friends as lazy. A true schizophrenia diagnosis cannot be made unless delusions, hallucinations, or disorganized speech is present, and this must be going on for more than 6 months. You have to make sure, like all disease processes, that you rule out the differential diagnosis, which can often coincide, the ones that coincide with schizophrenia or secondary psychotic disorders like a mood disorder. Some majorly depressive episodes can present with delusions and hallucinations. So this, of course, must be ruled out. All right, so you're this new grad nurse practitioner and you have this patient sitting in your exam room. You know, you're doing your fancy talk and everything that you've prepared for, and you're pretty confident that this patient is a newly diagnosed schizophrenic. What are you going to do next? First and foremost, you're going to have to determine the need for acute hospitalization. Hospitalization is indicated for diagnostic purposes, stabilization of medication, and for patient safety in case the patient is suicidal or homicidal. They could be also having some grossly disorganized or inappropriate behavior, and including the inability to take care of basic needs such as clothing, shelter, or food. So you must keep in mind when you're doing this safety check to make sure what you're going to do with your patient. You have to keep in mind your geographical resource. So some areas have great mental health access where this could possibly be performed in an outpatient setting, of course, after determining the safety and resource the patient has. Others absolutely have no resources, and your only option is inpatient hospitalization. So starting out as a new grad nurse practitioner, that is something that you're going to have to establish with your geographical area, with your the person that's training you, so that you know the resources that you have around you. Second is you're going to have to understand that noncompliance with long-term antipsychotic treatment is very high. So it's going to be your responsibility to establish a trusting relationship with your patient provider. Okay, so you want this patient to know that you're on their side and you have an open door for any issues that's guaranteed to arise. You want this patient to trust you and to know that they can come to you and that you're their friend and their provider. Okay, this is going to have to be established at the very first encounter. You want them to leave with a good taste in their mouth regarding you. All right, the third thing that you're going to have to do is you're going to have to advocate for this patient with your company. Your company and your resources are going to have to pull together to get some kind of team management for success for this patient, okay? They're going to need social skills training and family-oriented therapies, and you're going to have to understand that this patient is going to require a lot of time outside the office appointments as well, okay? And lastly, don't freak out. If you are the primary care provider of a newly diagnosed schizophrenic, you will need to collaborate with consults such as psychologists, psychiatrists, social workers, and many more resources. You're not going to be in this fight alone. And that being said, you'll need to follow the recommendations from the psychiatrist regarding pharmacotherapy for the patient. Thank you, guys.